What complications can occur if diabetes is not managed properly? Let's understand what really happens over time when diabetes is not well controlled. When blood glucose remains high for many years, it slowly damages the lining of blood vessels and the nerves that run alongside them. This damage does not happen suddenly. It builds up quietly, which is why many people feel fine for a long time even when harm is already beginning. The smallest blood vessels are usually affected first. In the eyes, damage to these tiny vessels can cause them to leak or close off, reducing blood supply to the retina. Vision may become blurry slowly or sometimes change suddenly. Early on, many people do not notice any symptoms. That is why regular eye checkups are important even when eyesight feels normal. In the kidneys, the filtering units are made of very tiny blood vessels. High glucose levels weaken these filters, making them leaky. The earliest sign is often protein in the urine, long before pain or swelling appears. Without timely treatment, this damage can gradually progress to kidney failure. Nerves are affected as well. Reduced blood supply to nerves leads to diabetic neuropathy. The most common form is peripheral neuropathy, where people experience numbness, burning, pins and needles, or loss of sensation, especially in the feet. Because sensation is reduced, small injuries often go unnoticed. Another form is autonomic neuropathy, where nerves controlling automatic body functions are affected. This can lead to dizziness on standing, irregular heart rate, digestive problems, bladder issues, sexual dysfunction, or abnormal sweating. Over time, diabetes also affects the larger blood vessels, which has a major impact on long-term health. Blockages in the arteries supplying the heart develop faster in people with diabetes. Heart attacks may occur earlier and can sometimes be silent without typical chest pain. When arteries supplying the brain are affected, the risk of stroke increases. Reduced blood flow to the legs can cause pain while walking and slow wound healing. The feet are especially vulnerable because poor blood flow and nerve damage often occur together. A small cut or blister may not be felt, and without early care, it can quickly turn into a serious infection. Some people are at higher risk of complications, especially those with long-standing diabetes, poor glucose control, high blood pressure or cholesterol, tobacco use, excess belly fat, or irregular follow-up and medication use. Here is the most important thing to remember. These complications are not inevitable. They develop slowly. With early testing, consistent blood glucose control, good blood pressure and cholesterol management, proper food care, and regular follow-up, most complications can be prevented or delayed. Diabetes is serious, but with continuous care, it is manageable.